Even sometimes when you're feeling great, there might be something brewing under there that your screening test can catch. Hi, I'm Sara Horton. I'm a medical oncologist, which is a cancer doctor. Did you know most cancers are preventable? The leading cancers today are lung, breast, colon, and prostate. Have you heard about cancer screening?
Yes.
Tell me what it means to you.
So cancer screening, I think, starts before you have the actual screening, and I think it's going to your family history.
Having regular checkups, checking your body.
I try to be aware of any changes in my, body or where there might be a wart or a mole that changes size or color.
This is something to prevent these cancers from ever coming and causing problems. Some people feel they need to wait until they feel bad. Even sometimes when you're feeling great, there might be something brewing under there that your screening test can catch. Do you know that there are certain types of cancers that can be totally prevented even if you don't have a family history?
I guess not, because one of the understandings I had from my doctor was that there aren't very many pre-screening.
So the screening test for breast cancer is a mammogram.
Oh, well, of course, yes, I had mammogram.
Okay,
Yeah.
good.
Well, I know for breast cancer, it's supposed to be women over 40, right?
Right.
For mammograms.
All women or just women who have family history?
No, I think everybody, right?
I was just trying to walk you into that one. Right.
Yeah.
Some people kind of think that screening is only if you're having a problem or if you have family history, but you've said what's correct. All women should have this screening. Are you aware of the screening test for colon cancer?
Colonoscopy?
Absolutely. And have you had that?
I have had them.
And do you know when you start?
Fat 50?
It was 50 for many, 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 many years.
That's when my parents started.
Yeah, that's when I started, but they have changed now to 45. So that's the other thing about screening. Screening guidelines change as we get more information about colonoscopy, and now there are some other things that they're doing in lieu of colonoscopy, but colonoscopies are still what we call the gold standard, the best way to pick up polyps. Are you familiar with the other type of screening tests that we have available to prevent cancer?
I'm not.
Okay. So for men, prostate screening.
Right.
So at a certain age, and it's around 40 now, especially for African-American men because prostate cancer starts earlier in the group, getting a blood test called a PSA. And then also a urologist or your doctor can do a prostate exam.
Now, men of my generation, several of my best friends have had a problem, and so I do get screened for prostate cancer every year. Take a PSA test,
Yeah.
and then go to the urologist, and so far so good.
And then the other one is for lung cancer.
I'm not familiar with that one.
Not as many people are familiar because this blood cancer screening isn't for everybody. It's actually just for people who have had a certain amount of exposure to smoking in the past.
Both of my parents smoked really heavily when I was growing up, and even though they quit in their 40s, my mother has COPD.
This type of information is information that we don't quite know how to act on yet, but is being studied. We're starting to gather that we call demographic information. Secondhand smoke exposure, especially as a child, is starting to inform us about changes that we can, from DNA standpoint, can start looking for. So if you're not someone who was a smoker, then your doctor probably has not talked to you about getting screening for lung cancer. We're getting better at determining who we could help live longer by finding an early lung cancer, but it really depends on your smoking history. And we're talking about if you have a certain, what we call pack year of smoking, meaning maybe you smoke for 10 years, half a pack a day, and that's kind of like a cutoff saying, you're someone who, because of that, has an increased risk, and we'll start you with a low-dose CT scan. If you're a smoker, if you have a history of smoking, we now do low-dose CAT scan, CT scan,
Nice, okay.
to help detect lung cancer earlier. So don't wait to get your screening. It can save your life. To learn more about the importance of cancer screening, contact your primary care physician.